Today I'm going to show you guys a really awesome dashboard that was built by the NEMSIS people. And this dashboard sources data that EMS agencies have been submitting for the last couple of years. It is open to the public. It's a great tool that can be utilized by anyone. So whether you're a street medic, EMS director or chief, you work in a hospital system, or you're just someone that's an informed citizen, this dashboard can help you better understand what's going on in our industry, as well as maybe what's going on within your community. So this dashboard is available on the NEMSIS.org website. Some great features about this dashboard is that it operates within your web browser, so you don't have to worry about installing any type of special software. So we'll cut between myself and my screen to show you guys, but I've pre-selected a few different filters. So I have car and truck van selected under the type of incident. So as we scroll through here, we have some generic demographic information. So we have some age and gender, race type information. We also have dispatch time, day of the week, and then dispatch month and year that to reference. Further down, we have incident details. So we have scene times, and then there is a toggle filter for scene time, scene response time, and transport time. So those really play those are really a nice factor to utilize when you get down into the geographic area at the bottom. Moving further down, we have our probability of survival, which is based off of the rapid trauma scale. And then we have injury risk factors, and then type of drug or alcohol indication. One thing to note about this is that the percent of total is the percent of total of the records for the sample, and then these break down further based on our samples. So just keep that in mind when you're toggling filters throughout here. And their geographic territories are as far as we're able to drill down. So you're not going to be able to get zip code or state or city specific. You're just going to get these generalizations. However, if you're an urban or a rural or suburban or a wilderness provider, it will really help you out with that. So one thing, just going back to what we had selected with our car and our truck/van that we look through here, we see that the majority of the patients that are injured tend to be females between the ages of 20 to 24 years of age. So 6.82% of those patients encountered. So 39,666 encounters were females between the ages of 20 and 24 years of age. Of those, the race, the majority of the patients were white, followed by Black or African American, followed by Hispanic or Latino. And of course, this is information that's input by the EMS crew. And then we find that the time where these injuries occurred, or these responses occurred the most, were Friday between 12 p.m. and 6 p.m. And then generally speaking, it seems to be that January has the least amount of calls, and then it just kind of climbs as the year goes on. Scene times, the majority of the scene times fall between the range of roughly about 7 minutes of scene time to, we'll say, about 18 minutes. So, it ramps up from there, and then it peaks at about 10 minutes, and then it curves down. The good news is probability of survival is that most of these patients, a whopping 370,717 encounters, had a probability of survival of 96.9%, and we know for the most part that is probably true. I'm willing to bet the majority of the incidents in here, or not the majority, but a good portion of them are probably patient refusals. The injury risk factor, the number one selected or documented, was the crash intrusion, including roof, 12 inches or greater into the occupant, 18 inches within any site. So understanding the NEMSIS data elements is somewhat important here so that you understand these different selectors. Of the accidents, there were 3.59% of them, or sorry, of the records, 3.59% include some type of drug or alcohol indication. Within those records, 3%, a little over 3%, had patient admits to drug or alcohol use. And then 1.62 said smell of alcohol on breath. And I won't get into whether or not that is, good to document or not. And then patient admits to drug or alcohol use had 0.86%. Now, what was interesting is that when we started to differentiate between the urban city geographic range, we got some different data. So we saw that when we switched between urban and rural and suburban, it changed slightly the age range of the female patients that got hurt, but overwhelmingly it seemed to be that the female suffered more injuries, or sorry, they were more of the patient population than males, I should say. So this is a cool little dashboard to use. I would encourage you guys to check it out. It's available at nemsis.org, and it's a great way to benchmark and explore the data that EMS agencies have been submitting. And if you have any questions, comments, thoughts, feedback, I welcome them. Please let me know. Thank you for taking the time to check out this quick little video.